Here we go.
Oh, hi John, how are you?
Nice to see you again.
Yeah, indeed.
John Barclay is heading in for his regular checkup.
So how are you going on the new medication? Is
It
that
seems to be working okay.
The 70-year-old is being treated for deep vein thrombosis, so quick, easy access to his health records is crucial.
If anything happens, then anybody who sees you knows. Is that okay with you?
That's absolutely okay.
Dr Charlotte Hesp is John's local GP.
Excellent. At the moment, we just operate under silos. So I do my thing, the hospital does its thing, the private hospital does its own thing, the specialists and or allied health people do all their own thing. And there's no means of really actually making sure we're all on the same page.
For some patients, a nationally linked digital health record system can be a life and death issue.
There is no doubt that a national database, well coordinated, available at the point of care, will save lives. Their mental health record, their physical health record, what medications they're taking, what treatment they've received. Having that information available at the point of care, particularly crisis care, will save lives.
In principle, there seems to be furious agreement among health professionals that in the digital age, the days of finding and faxing paper records around the country should already be long gone. But there is disagreement about the legislation governing the My Health Record system, particularly Section 70, which says that health records can be handed over if the Digital Health Agency reasonably believes that it's necessary to enforce laws, investigate crimes, or to protect public revenue. Significantly, the legislation does not explicitly state that a court order or a warrant is required.
It's a patient's ultimate choice about whether it's uploaded or not. They'll have to get a health record anyway.
And that's what's bothering Professor Karen Phelps, who has joined other former presidents of the Australian Medical Association in demanding that the legislation be redrafted.
A number of former AMA presidents have now spoken out and said that they want to extend the opt-out period and have a proper analysis of the legislation and its impact on individuals and confidentiality in the healthcare sector, and to make sure that we get this right, because if we don't get it right, the whole system is going to fail.
New AMA President Tony Bartoni was under pressure at the National Press Club in Canberra yesterday and agreed something had to change.
Will you be asking Health Minister Greg Hunt to change the legislation so Section 70 is reformed?
I will do whatever it takes to ensure that the ambiguity and any discrepancy between the legislation and what currently is the standard practice, or what we all practice under, is removed and put to bed once and for all. Whatever it takes.
The Australian Digital Health Agency, which is running My Health Record, says its policy is not to share people's health records unless a court orders it to.
We need to look at what the agency's saying. It's the system operator. It's saying unless there's judicial overview. Now, if a judge says, yes, you should get access to the data, I think Australians understand that that's the sort of overview we need. If there's a court order or a judge that's had a look at the data and says this is reasonable, then it's reasonable.
It isn't simply a policy. This is long-standing legal precedence in Australia. So right now, your medical records can be handed over to the police or other agencies under court direction.
If a breach has been confirmed, take steps.
Karen Phelps is worried that if not written into law, the agency's policies could be changed.
Do you want certain agencies knowing that you have a mental health diagnosis, or that you're taking antidepressants, or you're taking particular medications that maybe you don't want other people to know? Do you want strangers in the tax office knowing about it? These are the questions you have to ask yourself.
There is ongoing debate in my area. Mental health areas are very sensitive. You do always have the option to opt out. But collectively, we all have so much more to gain by being in. So in my view, this situation now where we're all in, unless we have a very specific personal reason to be out, is of the national benefit. And I'd like to see Australians behave collectively for a public good when the personal risk is actually very low.
The setup of Australia's digital health record system also comes in an age of mass data breaches. Just this month, almost a quarter of Singapore's population, 1.5 million people, including the Prime Minister, had their health data hacked.
There are over 6 million Australians with My Health records. There have not been any complaints of privacy breaches in all of that time.
Just because we've had 6 million people for 6 years and there's never been a breach doesn't mean there won't be. I think that's just foolhardy. People won't believe that. What we can give the assurance to is that we'll do the very best we can. What we can also say is actually it's better than the bank, and it's a lot better than the bank.
The doctors of some of the AMA and the College of General Practitioners who support My Health record have raised some issues which they've discussed with the Health Minister, and they will be addressed. But this is a program which has had bipartisan support for a long time.
Australians have until October 15 to decide if they want to opt out of My Health record. If you do nothing, you're in.